Dr Christine Greenwood, thank you so much for joining me today.
You are welcome, Mitchell. What a privilege to be here. Thanks for having
You're
me.
too kind. Anytime. Well, look, we're going to dive into perimenopause today.
Yeah.
The first thing that I wanted to ask you, and this is based off the clients I work with and the women that I talk to,
Yeah.
for such a biological rite of passage for women, every woman on the planet's going to go through perimenopause under their own sort of circumstances, different symptoms and whatnot. Why is there such a disconnect, I suppose, with knowledge or information? I feel like women get to this junction in life and feel a little bit lost, unsure. Where do I start?
Yeah, absolutely. And I think this is a great question and hopefully it will change. I'm hoping my daughter is just turned 2 and I am praying and hoping and trying to carve out a different situation for her moving forward. But I think it's a huge lack of information, which is really multifactorial. So number one, as young kids and as teenagers and growing up, we weren't taught about perimenopause. We were taught how to not get pregnant. The most important thing about having sex before marriage was do not get pregnant, do not get an STI. So it was all about the pill, it was all about not getting pregnant. And then by the time you are trying to have babies and you get pregnant and then you raise your family and then boom, nobody actually talks about what happens after you're 40, right? And then on the other side of it, doctors aren't trained. So I've been a doctor for 15 years. I'm older than I look. I trained throughout my whole training. I did an undergrad as a nurse, and then I did a postgrad, did 5 years as training to be a doctor, and then I did a year as an intern. In all of those years of training, ask me how much time I was spent training on perimenopause and menopause.
I
Ask me.
heard a crazy statistic, and you'll be able to confirm this, but is it something really ridiculous like an hour and a half out of the whole sort of course?
Actually, worse, zero. And
Okay.
I wanted to be an obs and gynae, so I spent a lot of time in obstetrics and still zero,
So
zero, zero, zero. And
perimenopause, menopause isn't a topic that gets
not
discussed.
once, not even for a minute.
Do you think that that will change?
Absolutely,
And
if I have anything to do with it.
what can make that change?
Yeah.
How can it become more of a uh, how can it at least not be a day course
Yeah, I love that. And
at a
so,
minimum?
absolutely, I think if we push to put it in the curriculum of the training doctors, and then at the very least put it in the curriculum of anyone in obs and gynae and anyone doing general practice, and then that will happen because people were becoming more aware. So the amount of women that I am getting that are like, I have read this, I know this, I want this, and I think as we as women become more empowered to dictate how we want the rest of our lives to look like, it will force the medical profession to be more prepared.
Do you think, I suppose, the fact that it isn't being spoken about
Yeah.
in people's education, coming up as doctors, GPs, etc., do you think that that is more or less perhaps the start of the confusion for women because you start to experience all these symptoms and changes both physically and mentally?
Mm.
You go and see your local doctor, your
Mm-hmm.
GP, whoever you've been seeing for the last 10 years,
Mm-hmm.
and then they themselves are scratching their heads or
Totally.
maybe just palming you off to the next person who might know a
Exactly.
little bit more.
Exactly. And I was one of them. I was one of the small little doctors that actually had no idea what the F was going on to the women. And Mary Claire Haven says it really well, where they used to dread what they called was the whinging white women, the women that came in, they didn't have anything wrong with them, but they felt unhappy, they were gaining weight, weren't coping with life, and they would just say that they were whinging. And so, how it also works, so that all the women out there who might be experiencing this, is in perimenopause, there's no actual clinical way to tell. So, you could go to your doctor and your bloods will probably be absolutely normal. Now, there's an exception of 1 in 100 women that will go through early menopause. So they may have some abnormalities in their blood or what we call rising FSH, which shows that you might be going through perimenopause. But most of the time, your bloods are normal. So you go to your doctor and you say, oh, I feel so terrible. I can't put my finger on it. I feel tired. I'm not sleeping. I'm gaining weight. I'm not who I used to be. My libido zero. Sex isn't pleasurable. Any of the millions of things that you may feel. The doctor will do your bloods and go, you're absolutely normal. Here's an antidepressant. And so that's why there's that massive disconnect between the education of the doctors and how the woman feels. And so many women feel so disenchanted, unheard, and untreated, and can often spend that time from, say, mid-40s to their over 50 feeling completely not themselves.
And that's one of the first symptoms, isn't it? Or one of the first, I suppose, mental symptoms of perimenopause is not being able to put your finger on it. And this, I've spoken to my wife about it, just not feeling yourself.
Yeah, exactly. And I have that all the time. I was saying to you before, Mitch, I see, about 120 patients a week, and most of them are perimenopause, menopausal women. And often that's what it is. People say, oh, I'm not getting the hot flushes, right? So I must be okay. But more often than not, the most common symptom that I have is I don't feel myself, and I can't put my finger on it. I just feel apathetic.
Which would be a terrible feeling, not knowing what's going on. It's not like having a cold or a flu where you've got these symptoms and you know exactly what's happening.
Yeah, you think you're going crazy.
You think, yeah, well, that's what my wife said.
Yeah,
She's
you're going
sat up at
crazy.
night thinking that she's going crazy.
Or that you're really ungrateful, because a lot of people have made a life for themselves that they love, and so they've created everything that they wanted, right? And so by the time they come to me, they're like, I have everything I've worked for and I cannot enjoy it because I'm so unhappy.
Yeah. Simple question, maybe not with such a simple answer. What is perimenopause?
Yeah,
Let's
I love
break
this
that
question.
down. And
Yes.
if you don't mind, to its most simplistic form.
Yes.
So we can
okay.
digest it.
No, absolutely. Well, to learn it, I went down to its most simplistic form.
Great.
So essentially, every woman is born with a finite amount of eggs, okay? So you're born with your eggs. And so as you go through puberty, as you start menarche, which is your first period, you release your first egg. Then every time you ovulate, which for women is once a month, you lose an egg, okay? So that happens all throughout time. When you reach, say, perimenopause, what happens is that your eggs start to get much decreased in quantity and decrease in quality. Now, what that means is that, say, once you're 40, you only have a very small percentage of your eggs left, right? So every time you ovulate, it may not be every month. So when you're not ovulating, your periods no longer are regular. And so with the irregular periods, what happens is that you enter the perimenopause storm. So you have irregular periods, you're not ovulating every time, your hormones are everywhere. Now, this can start happening in, say, early 40s, or for some other women, it might start happening in their mid to late 40s. So they might start having irregular periods, crazy cycling of their hormones. So 1 minute their estrogen is crazy high, they feel okay. Next minute their estrogen is down at their boots, they're crying in the corner and they're not sure why, because their husband maybe blew his nose, or heaven forbid,
Ask where the scissors were.
Yes, like what an asshole. He literally wants to kill them. And you don't know who you are, right?
Yeah.
And that's because your hormones are cycling like crazy. High, low, high, low. Your periods are irregular, they're crazy heavy or they're crazy light, or you're having huge amounts of clots in between. And basically it's because now you're having anovulatory cycles, meaning that you're not ovulating every time, you can't predict them, and your hormones are everywhere. And that happens until you've finish all your eggs, and then you no longer get a period, and then menopause happens, which is when you have 1 year without a period.
So it seems like it's this big drawn out period where it's like ovarian retirement, where
Exactly.
everything just starts getting a little bit
Yep.
shaky. And I suppose if that's some of the symptoms which you're experiencing, which many and all women will, that's when you know, like, I suppose, like, yes, this is perimenopause.
Yeah.
My cycles are just all over the place.
Yeah.
I'm feeling and experiencing these different sort of patterns.
Yeah.
Very good sign.
Yeah, 100%. And so what will happen as well is that's super individual. So some women will be like, I feel like a little bit, but not too bad. And then they go through menopause and then they're over and done with. Other women literally nearly feel like they're losing their minds.
Yeah.
And the amount of people that go into a deep depression, their relationship becomes on the rocks. and they really, really suffer. Often they can't function in their roles and they lose their confidence at work at a time, Mitch, that you have more experience than any of the young 20-year-olds. You should be owning your shit at work.
Yeah.
And it's a time that a lot of women are like cutting down their hours, even quitting their jobs because they don't feel like they have got enough to give or that they can cope anymore. Have had amazing trained health professionals actually throw the towel in because they literally don't feel safe. They don't feel like their brains don't function.
I mean, I've had that conversation with my wife where we are blessed and lucky to the point where we work from home. We've set our business up where we've got a little bit more wiggle room as such. There's some days where Riss is so tired, so exhausted to the point where she'll have a full night's sleep, but she'll have to go and have a rest again at 9 o'clock in the morning.
Yeah.
And we feel for women who aren't in that position, who can't do that, how many days off work they may be having, how much lack of understanding there might be from employees towards women who are feeling this.
Yeah.
The ripple on effect with perimenopause, the more that I look into it from like a society standpoint, it stretches so wide, doesn't it?
Yeah, absolutely. And also, if we can provide support to women in the workplace as well during this time, you come out the other side and they're better than ever. Like they're better than ever. So it's also about creating compassion and understanding as well as providing early support, I think, so that you can absolutely like women make up what 80% of our workforce, or at least 50 depending on where they're working. And so it's actually such a huge time, and I think so much to be taken in the future to really support and uphold women in that time.
I think conversations like this are just the start of maybe getting workplaces to start to, I don't know, use some of that Christmas fund or something to have somebody come in and discuss this, because then you wouldn't feel alone. Women aren't feeling alone.
Education
I'm
in
not
the
crazy.
workplace.
I'm not crazy. This is actually happening.
Yeah.
Something that I really wanted to touch on today, and I know you're going to give me your insight on this, and this is something that I bang on all the time with my audience in particular, but I want to hear it from a doctor.
Yeah.
Why is bone density so important during perimenopause?
Yeah.
And what do we need to look out for?
Yeah, I absolutely love this question. It's probably my number one favorite topic. I was brought up in, 80s where being the skinnier you were, the better, right? And so no one was thinking about their bone density when I grew up. Everyone was thinking about how thin they could get. And so because of that, it's really wreaked havoc on the women that are going through menopause these days, because a lot of us has calorie restricted our whole lives, done a heap of cardio and haven't trained on weights. Now, the problem with that is that from 40, your bone density will start to decline. So you have a finite amount of time to build up your bones. Now, when you go, not even when you're going through menopause, but as you get older, so from 40, you are no longer building new bone. And then as you go through peri and through menopause, in those first few years, you can lose 25 to 30% of your bone density.
That is staggering to me.
Wow, that's 1/4, right, of something that you've built your entire life. So many of the time, by the time women have come through to me, unless they've had phenomenal bone density, they already have early bone damage.
Yeah.
Now, so by the time you've gone through, so if you're in peri and in menopause, now is the time that if you want to reduce the rate at which your bones are literally dissolving or declining, strength training, there's 4 things. So there's strength training, there's adequate calcium, 1,500 milligrams in your diet. Everyone wants to take a pill, but get it from your diet.
Yeah.
Your body will absorb it better.
Yeah.
Vitamin D, enough vitamin D, and you can check your levels to do that. And then if warranted, estrogen and HRT, right?
Okay.
And the reason why is if you don't replace it in those 4 ways, if you don't prevent it from getting worse, your bones will decline, especially once you're in peri and through menopause, and it will lead to osteopenia, which is the one before osteoporosis, which puts you at significant risk for fracture.
And I mean, fractures, breaks might not sound so intimidating or scary when you're, in your teens or in your 20s, but the reality is, and again, I think you might have some stats on this, breaks and fractures when you're in perimenopause and menopause in terms of recovery
Yeah.
and then long-term effects for your health are
Yeah.
quite severe, aren't
Oh,
they?
it's really it actually feels really petrifying. But if you fracture your hip, only 1 out of 2, so 50% will recover, and the same amount will return home, meaning that you go from the hospital to a nursing home. And that's because breaking a femur, which is one of the biggest bones in your body, when you're older, actually causes chronic pain, and many people don't move again or move to the way that they would like to. It's actually petrifying. And then fractures of the spine. I don't know if anyone knows anyone that's fractured their spine because of osteoporosis. Causes chronic, excruciating pain. It causes kyphosis, so where you see those little old ladies stooped.
Hunching forward.
That's what osteoporosis does, and there's no cure. There's no cure, and so that's why I say, my God, guys, osteoporosis, osteopenia, it's 100% preventable.
Yeah.
100. Like, there is a complete prevention. My daughter should never get it. And if we can teach our young girls and catch in peri and our menopausal women, we can prevent anyone from ever getting there.
And it doesn't have to be as complex as you think when we talk about
absolutely
bone
not.
density. Like you said, good nutrition, 1,500 milligrams of calcium, even just 2 strength training sessions a week.
Yeah.
Well, I think it's really important for women to understand as well that it's not about picking up those little light weights and doing
Yeah.
thousands of repetitions. You know, life's too busy as it is.
Yeah.
We want to look at lifting a heavier weight that's going to promote the lean muscle mass. You're
Yeah.
in and out of the gym, you're focusing on your strength. And of course, the byproduct of increasing your bone density, or at least maintaining your bone density, is going to be good, healthy, lean levels of muscle mass as well.
Absolutely, absolutely. So what I'm trying to encourage and I think one of my biggest complaints, actually, and Mitch, you probably feel like this too, is I'm gaining weight.
Yeah.
Right? And people, but honestly, sometimes they don't have any menopause symptoms. What's bothering them is the weight gain. And again, what's happening there is that your lean muscle is turning into fat. As your lean muscle turns into fat, it redistributes around your tummy, around your upper trunk, and then decreases your metabolism.
It's a vicious cycle.
It's a vicious cycle. So number one, you're gaining weight so you don't feel like moving. Number two, your metabolism is slowed because you've lost your lean muscle. And then also that's wreaking havoc on your bones, right? And so the strength training part, changing your mind to being like, I'm going to eat less and do endless cardio, it will no longer work. I promise you, it will no longer work. I have women running marathons and barely eating anything, and it's not working for them. And so what you want to focus on now for your bones, for your body, for weight loss is building lean muscle.
It's basically thinking about things in reverse and changing the whole direction of it, and knowing that strength training in conjunction with your nutrition is going to increase your lean muscle mass, which is going to help you basically drive that body fat down, change your body composition. I mean, it's a hard pill to swallow for a lot of people, because particularly women, get so stuck in the drop your calories to 800 per day, run 10 kilometers a day. The damage of that is you can only do it so short term. But if you're starving yourself as well with really low calories, the chances are you're not getting your vital nutrients that are required to make all those things happen that you should be focusing on.
Exactly.
One other thing that I would like to talk to you today, and this is something that you mentioned in one of the appointments that I came to you with my wife. Thank you so much. And I thought it was a really cool way of describing it, is you mentioned women's health during perimenopause and menopause as like a tripod. We want to look at, our strength training. We want to look at nutrition and sleep, but then we also need to investigate the massive benefits for some women in terms of HRT. Would you be able to touch on that a little bit for me? The HRT side of things.
Yeah, I love that. So I always think this time of your life, in perimenopause and menopause, if you reframe it as, wow, this is an exciting time. This is a chance for me to make this next season a new start for myself. Okay. And there's no magic bullet, right? So there's no one thing that's going to change the game. It's a combination of about 4 things. So let me do the HRT part first, because that's the part that a doctor can do. So what happens is that in perimenopause, your estrogen and progesterone and testosterone are going up and down, especially your estrogen, but all the while your estrogen's declining. Now, what can be helpful if you're super symptomatic, right, is if you replace or supplement your own hormones with external hormones, okay, which is estrogen, progesterone, plus or minus testosterone. Now, this may not work for everyone, and if you have crazy heavy irregular periods, you might want to consider a Mirena, which is a synthetic progesterone that you can put into your womb, and that will prevent you from getting heavy periods and most of the time take them away. And that can be the progesterone component of your HRT. And then what you would do is take some estrogen, body identical estrogen, not a synthetic estrogen. So remember the difference. With HRT, we're using body identical estrogen and progesterone and even testosterone. With synthetic estrogen and progesterone, that's what you use in the pill, right? So that's why many people are like, I can't take that, doctor. I had a terrible reaction to the pill. I was cranky. I gained weight. It's completely different. We're not talking about the same drug. We're talking about body identical hormones. Now, if you need them in the peri, they can be incredibly useful, especially the progesterone component, because some people just need to stabilize their hormones while they're going haywire. It won't cure you, but my goodness, it can help. And then in menopause, it may become one of the game changers, supplementing your hormones. So that's one. So that's the estrogen, progesterone, plus or minus testosterone. Then you've got nutrition, which we talked about. What we aim for with nutrition is adequate protein and adequate fiber, right? So rather than going, this is how many calories you need, I always say focus on getting in 100 to 150 grams of protein a day and adequate fiber. If you do that, it's hard to fit in other things.
Those two things alone are going to satiate you.
Yeah. How do you get people to calculate how much protein they need for individual?
We've got a calorie calculator that people
Yeah.
can use, but just a rough rule of thumb, if you can achieve 1.5 grams of protein per kilo of body weight each day, in conjunction with fiber, 25 grams of fiber, I believe, for women.
Yeah.
If you can do both of those things just as a base start without overcomplicating the whole realm of nutrition, you're going to put yourself in a fantastic position for lean muscle mass, for weight management, and just overall health.
Exactly. Yeah. And I say exactly the same. Rather than thinking about, can't eat that donut and obsessing over all the things you can't eat, focus on trying to get that amount of protein in and that amount of fiber. I also understand that we're busy people. We might not be able to be Hailey Bieber and get in that much fiber. So then take a fiber supplement, right? Get some Metamucil in. Go and Mary Claire Haven has a non-flavored laxative. Take that. So you can make it work for you. So we've got nutrition, and then we've got exercise, which we talked about was at least like start off with 2, but then move to 3. And in my opinion, this is a great time to invest in a personal trainer if you don't have the confidence to weight train.
Yeah.
Do you have any other ideas? Because a lot of my women have never lifted weights in their life.
Yeah.
So it's really overwhelming to think about going to a gym.
Yeah, definitely. I would be looking at things as a progressional standpoint. If you are nervous to go to the gym, I think that this sort of falls under the umbrella of being perhaps a little bit uncomfortable with your fitness level, a little bit uncomfortable with how you look perhaps. And that all just throws into that whole gym anxiety, because we assume that we're going to walk into a gym and everybody's just going to judge us.
Yeah.
You know, here's a new person, let's watch how they train. It doesn't work like that. So I would say that if you can start working on your nutrition, start losing some weight. You'll build some confidence with your routines. You can then even just begin with some body weight exercises at home. This will give you the belief that, hey, I can actually exercise. This is somewhat enjoyable. That a lot of the time is a fantastic progression to getting people into the gym. Exercising at home is fantastic, don't get me wrong. But if you don't have the ability to load your bones with that additional load, okay? There's a lot of women training at home with just light dumbbells. So you do need to get to the point where you've either improved your home equipment or you do move into the gym.
Yeah.
And
Yeah.
it can be a fantastic environment. There's so many female gyms now as well,
Yeah.
women's
Fernwood.
only.
Yeah.
Fernwood's fantastic.
Absolutely.
And one thing I will say about gym anxiety as well is, for the most part, everybody is really extremely supportive as well.
Yeah.
We do assume that everybody is watching us and judging
Yeah.
us, but the reality is
Oh, they're looking at themselves.
most people are pretty damn focused on
They're
themselves.
taking selfies.
They're taking selfies. They are. They're focusing on
Yeah.
themselves.
Yeah. Agreed.
Just as a finisher,
Yeah.
Christine, I just want, I want to get into the position of a woman who is currently just at that juncture, who is so confused about perhaps where they are,
Yeah.
how they're feeling. What
Yeah.
would be one of the first steps that they can make in terms of just getting themselves checked from a hormone standpoint?
Yeah, I love that. So, if you go to the AMS, which is the Australian Menopause Society, it has a list of doctors who are trained in menopause, right? So, I would find someone near your area to go to, even if you have to drive an hour, to make that experience to be with someone who's going to understand you, who also has a background and an interest in perimenopause and menopause. So, I would do that first. Secondly, I would start to arm yourself with knowledge, because knowledge is power. So there are a few of my absolute heroes that I follow who are very, very, I guess they're super trustworthy. Everything they do is evidence based. That would be Dr. Mary Claire Haven. Follow her on Instagram. There's Dr. Kelly Casperson. Follow her on Instagram. She's also written a book called The New Menopause. And there's Dr. Louise Newston. So all these three are probably my top three picks. And then in terms of exercise and bone strength, I would follow Dr. Vonda Wright, who is a leading space. She's an orthopedic surgeon and specializes in menopause. Brilliant. And then there's Dr. Stacey Sims. Now, she is leading the space in muscle building as well as nutrition to build that muscle. And all these women are really, really paving the way. So if you just go onto Instagram and follow each of those women, and then what will happen is that you'll start to empower yourself with the right information, and find a doctor through the AMS who it has an interest in the area, so that when you go, you don't feel like you haven't been heard, and you're seeing someone that has an interest and can actually walk you through this time in your life.
Absolutely. And look, I'd be doing you an absolute disservice if I didn't ask you, if people want to find Dr. Christine, where can they find you?
Yeah.
What's the steps?
Yeah, love that. So you can come and see me in person if you're on the Gold Coast at Her Medical, and you book in through the website. Otherwise, follow me on Dr. Christine Greenwood. Drop me a follow. I'm doing lots of exciting things, so I'd love to have you there.
Dr. Christine, thank you so much for coming in for a chat. I know I've actually gained some knowledge from this, and I fully think that all of the listeners will as well. So thank you for coming.
Oh, thank you. Thanks for having me.